Hello, everyone. Good morning. Good morning. Ooh, okay. So thank you for joining us today on this fantastic panel that is titled "Power of the Community" and investments, voices, and collective action to advance family planning. And we're here to discuss how to amplify the power and benefit everyone in this room and beyond. And thanks for joining us today here in person and colleagues and friends watching us live. We have a great panel today, and this is so amazing that this morning I was so excited and nervous, like I'm having a very high-profile panel with Supriya Madhavan, who is the senior health specialist at the Global Financing Facility, sitting next to me. And then we have Dr. Samu Dube, who is the executive director at ICFP2022. We also have the Honorable Dr. Thea Medard Antara, the Honorable Member of Parliament from the Republic of Tanzania. And then next to her is Nabiha Kaji Hutchins, who is the President and CEO of PI. And the last one, but not least, Amos Mewale, the Executive Director and founder of the Center for Reproductive Health and Rights. Thanks for joining, all of you. And also, it is really something, I was curious when I saw the title of the panel and I have to moderate. I was thinking like, yeah, maybe I'm also part of the community who would be watching you. And it's great to be with, sharing the stage with you in that case. So I would really like to go to Dr. Supriya first. Tell us briefly, and also like in order all the panelists. And tell us briefly about the organization you are working with, each of you, and how you are working to advance access to family planning and sexual reproductive health and rights services. All of the panelists, I would start with Dr. Supriya and then go to Dr. Dube. Dr. Supriya.
Hello. Yeah. Hi. Thank you. So the Global Financing Facility for every women, adolescents, and children really believes in closing the financing gap to allow countries, the 50 highest burden countries in the world, to achieve up to their sustainable development goals by 2030. So how do we do this? We have our core model is a country-led, country-owned, inclusive approach to ensure that there are collective actions to ensure equitable access to high-quality services to improve health outcomes for women, adolescents, and children. We support countries. We work through countries. We support countries. We have a large multi-stakeholder partnership globally that includes bilaterals, multilaterals, UN agencies, CSOs, private sector, and so we really the entry point is reproductive, maternal, newborn, child health, and adolescent health and nutrition. But it's in support of helping countries to achieve UHC. Thanks.
Thank you so much, Dr. Dube. Yes.
Thank you so much for that question. And so FP 2030, which was conceived in 2012 as FP 2020, is the only global partnership that focuses solely on family planning. And we've got this razor-sharp focus on family planning because we believe that the lift that we need to advance not only gender equality, but also economic progress in many countries and attainment of many sustainable development goals will do better if we include family planning in our programs. So what we do is that we provide a platform for our partners, governments, civil society organizations, private sector, and multilateral organizations, donors, and researchers. and even the broader humanitarian and development community to collaborate and share knowledge around family planning and how we can advance this economic progress. So we galvanize commitments from countries to make and operationalize them with an accountability framework to make sure we make progress to family planning in terms of access to rights-based family planning. So we play a unique role. We are not here to duplicate efforts of many organizations who are doing this work on family planning, but we make sure we galvanize the necessary conversations at community, at local, at country, and at global level, where we foster the exchange of technical expertise, providing a convening space for all partners to coalesce around the best practices in family planning. That's what we do. Thank you.
Wonderful. Thank you so much. And Honorable Dr. Antara.
Thank you so much. I'm a member of parliament working with Tanzania Parliament Association on population and development. So as a member, we really work so positively to access to family planning by engaging the government and stakeholders in various areas, strengthening the family planning program. Despite the effort, of course, in Tanzania, like many other countries, we are faced with child pregnancies, sex abuse for children, child labor, and also we have a problem of FGM. Still, in our country, for example, comprehensive sexual education is never explained or is never taught. So we go forward looking at this family planning. We have to strengthen, or we have to make sure that all this type of sexual abuse, type of sodomization, type of child labor, at least is said in the parliament. And again, we have a problem of male member of parliament normally don't talk much about this family planning issue. But us as a female member of parliament, we really talk much about family planning and see that at least all these other problems which are happening to our children, especially the girls' children, and today the boys' children, at least is diminishing. Thank you.
Hey. Member of parliaments are the great representatives of the community. You need to talk, and you will talk today. And there are people from Tanzania are also present in here and online. We have Nabiha from PA, please.
I hope this is working. Yes, excellent. Thank you so much, and for this space. I work with PAI, and we are a civil society organization that was founded over 55 years ago, 57 years ago, to be exact, with a focus to advance access and prioritize family planning as critical to advance progress for people around the world. And so we were founded with the intention and the focus and the mission to ensure that good policies, expansive investments, and the right attention was being paid to family planning. We were founded to hold our US government accountable and advocate to them to ensure that these steps were taken, and also advocate on the global stage with engagement to multilateral and bilateral institutions. We also recognize that we're part of a broader movement, given our mission of universal access to sexual and reproductive health and rights. And through that lens, we recognize that there is a critical role for civil society as an ecosystem, civil society coming together in coalition and working together to also advance the movement. And so as part of that, we provide flexible funding to 120 community-based civil society organizations across more than 35 countries, so they can hold their own decision makers, their own policy makers accountable, and advance sexual and reproductive health and rights for all, which of course includes family planning.
Thank you so much for advancing the power of community, the speeches that need to reach the power holders and the policymakers. Nabiha, thank you so much. And last but not least, Amos.
Thank you so much, Shaikat, and good morning, everyone. Thanks a lot. I think for us, Center for Reproductive Health, and Education is an organization based in Zambia. We are highly focused on sexual and reproductive health. We do not provide services. However, we are very key in the area of advocacy. As you have noticed, even from the panel, I think reproductive health is key, and CRHE in this case is actually the link between the community, the donors, the members of parliament, the government, and other partners. We bring the voice of the community to the table. We also ensure that we advocate for policies that are very inclusive. We advocate for domestic financing for health. We also want to ensure that sexual and reproductive health is at every development stage, especially where policies are concerned and also where development is concerned. Thank you.
Can we have a round of applause? What a great panel full of policymakers, civil society voices, leaders, civil society leaders across the world, commitment trackers like FP2030, and also a lot at great influencers. So Samu, I know that you just joined FP2030 as the Executive Director. Congratulations on that once again. And your organization, FP2030, has been able to catalyze over 50 commitments from the government, civil society, and private sector partners to advance access and to an investment in family planning. Many who are in the room already, including myself, what needs to happen to ensure these commitments are acted upon?
Thank you so much for that question. I think when we are here, we hear about commitments at a global stage, right? It's somewhat easy to say, yes, it's the right thing to do, we will do it. But where the rubber hits the road is in operationalization of that commitment. So what FP2030 does is that, number one, I think what we have managed to do is to sort of shift power from a centralized secretariat that was based in Washington, D.C., to a more devolved structure that is in regional hubs, so that these hubs will work with countries to galvanize these commitments. And to date, as we are sitting here, we've got about 41 commitments in total. Some are still in the finalization stage from countries, and nearly 90 from non-governmental actors coming together since last year, coming together to say we're going to do something about family planning. I think even the discipline of saying I'm going to commit itself is something that we have tried to instill in countries through a focal point structure that has got civil society, youth, government, donors, all in one place in terms of getting a commitment done. Once a commitment is done, operationalization of that commitment is through an implementation program that the government and these focal points actually sort of enact and operationalize at a country level, and we follow that up with an accountability framework. So as FP2030, to make sure that these commitments come to life, we help countries with that technical assistance that we broker through our partners. We also help them, the advocates, to draft smart advocacy goals to meaningfully improve access to contraceptive information products and services. We've got an accountability framework that countries have adopted, and we follow this through so that we are accountable to ourselves. You know, we've got a member of parliament here. That accountability, even to our citizens, is key. So we use that to sort of track progress for commitments. Then we use data to make sure that there is cadence and transparency. Where are we in terms of achieving these commitments? And the newly formed regional hubs are going to help us broaden the understanding of where countries are at, so that collectively we can stay true to 5 years from Pattaya. Where are we in terms of the progress that we really want to make? As a universe, as a collective, we promote mutual accountability approach for government commitments, where we are responsible as a collective for ensuring that the story of women and girls in accessing contraception is at least heard at a global level. So we remain globally connected to make sure that happens. You will see as you go across where commitment makers are in either operationalizing their commitment, where they are struggling, they highlight their struggles, and together with our partners, whether it's GFF, PAI, members of parliament, we make sure we sort of catalyze, inject an enzyme, time so that that commitment comes to life. That's what we do. And to date, we've been successful in doing that, even though we do have a few challenges. Thank you.
Wonderful. Thank you so much, Dr. Dubey. Basically, I was really looking at some of the commitments that Bangladesh government made, and we were working and actually advocating on those. You know, the commitments to AP 2020 formally and now AP 2030 are so powerful an element of advocacy, and also something that we really work on back in the field. So this is really very important, and I'm really looking forward to all the implementations in the next 5 years. I'll talk to you. Dr. Anthara, building from what Dr. Dubey has shared, and I would like to look at the considerations at the country level now. Honorable, Tanzania has been a commitment maker under both AP 2020 and now AP 2030. And the Tanzanian government has recognized that improving access to family planning is a priority. I have two questions for you. Number one, the first is, what has progressed in Tanzania look like, and what is noteworthy for us to know about? The second question is building on what my previous question. Can you talk about the partnership between the government and civil society to advance the family planning policy agenda? What has worked and what needs to be strengthened? I can repeat the second question. You can go for the first one now.
Okay, thank you very much. And indeed, there is progress. For example, today we have Her Excellency Samia Suluhu Hassan. Previously, family planning was very quiet. People dealt with only looking at using condom maybe to prevent STDs. But now, with the new president, who is a female, in fact, she knows that if we don't look into the number of population, which is increasing, we are going to be in danger. So today we are about 61 million. So we were 40 million 2012. Now today we are 61 million. Now you can see this tremendous increased number of people. So coming in with Samia, and what she says, because when a president says something, it becomes a law or a rule. So we are very happy now President Samia has said that, no. We have to look into the family planning. So family planning measures should take place so that at least we should go on, slowly and telling the families, no, we don't need 9 children, we don't need 10 children. It is too much. So giving this idea or telling this to the nation, at least it has opened up our mind that, no, we need to go with the family planning strategies. And again, not only to this one, for example, with safe abortion, at least today, the young parliamentary, the young ones who are in the parliament are talking about safe abortion. It was not easy for them to say, because they were worried, should we talk about safe abortion in the parliament? But there's a progress now. The young ones have started talking about safe abortion is important for the young ones. So this is also a progress in Tanzania. And I am sure just by starting talking, start telling the people in the house, people will get ideas, and maybe the government will do something to make it official that safe abortion is important. As so many girls, and especially the young girls, maybe they are dying, they are getting diseases because they do abortion without taking the precaution. So these are the progress at least we are doing right now as Tanzanians. Thank you.
Great. Do you want the second question?
Second.
Okay, let me repeat. So can you talk more about the partnership between the government and civil society to advance this agenda that you were talking? And I'm so thankful to you because of you are such a great advocate for access to family planning and abortion care. Thank you so much. Second question, please.
Okay. For the other second questions, of course, we have the local private sectors, and the youth have managed to start looking into this The local private sectors are helping to see that the family planning program is being done. We found that sometimes for these local private sectors, they also depend on foreign or donors so that they can help us. But we have said that no, it is not. It's now important for us at least to depend on our own, seeing that these local private sectors, they also take charge in helping the family planning programs.
Wonderful. Friends from Tanzania who are in the room, follow up with Dr. Ntara after this panel. Thank you so much, Dr. Ntara. And now I go to Amos. Let's go back to country level as well once again. Zambia had an important win, Amos, and it has also served as an inspiration, example to other countries. Family planning is on the government's national health insurance scheme. This is amazing. And civil society advocates like you, had an important role in achieving this win. What is next on the family planning agenda? And what is needed to achieve it? Be serious, Amos.
Thanks, Shekhar. First, let me, number one, comment that there is always power in working together, and the win did not come easily. I must mention that colleagues in the room, we really appreciated their support. We had a very strong team from Zambia that made sure that the family planning methods are inclusive in the insurance package that was developed. Secondly, I think we also had colleagues from the Ministry of Health who believes that it's key that family planning should be part of that agenda, and they believe in family planning, and hence they made sure that the agenda is part of the package that was developed. I must mention that in terms of progress, I think Zambia is doing well. We have seen that now family planning is part of the national development agenda. We just launched our 8th national development plan, and family planning is one of the pillars that has been highlighted. That itself shows that there is political will, and the government is doing that. And I must mention also here that our commitments have been finalized. You'll see them soon. They'll be launched. I mean, the government will be able to do that. Thirdly, we are concluding our national health strategy. Family planning has been also anchored in that as a key pillar for national development. And last but not least, I must mention that the allocation of resource in the 2023 budget are high towards family planning to ensure that the procurement of those commodities are actually there. So now, Shaikat, you're asking in terms of what is next on the agenda. With all what I have mentioned, I think we need to see to it that we realized the release of resources, okay? Because these have now been written, which was a key achievement. Now we need to see to it that the government actually is releasing those funds. They are going to the district. There's procurement of these commodities, and that the last mile community is accessing the product. It's not useful for us to have the documents well written when in actual fact, young people continue getting pregnant, they are not able to access the service. When women continue having not much of a choice, we believe in choice, and that is key. So we want to ensure that women have access to the method that they want when they go to seek the service. What is challenging is that when you go to the last mile, women do not have the method that they are looking for. So we actually just give them what is available. But what we are trying to do is to ensure that there is a choice that women can get, and they're able to use that choice which they are looking for. If that is done, then we'll be able to say that we have achieved our goal where women have this choice of a method that they are looking for. Thank you.
Oh, thank you so much, Amos. So many things that to follow up. I feel like advocates like you will be following up all the actions. If those budgets are spent well, are the women's getting the services at their doorstep, and also if those actions by the policymakers are really being followed up or not. So a great monitoring example, I hope that you will set from Zambia. We all look forward to. Thank you so much. I go to Nabiha, who is the president and CEO of PAI. Nabiha, so much of PAI's work involves supporting and expanding the civic space for SRHR advocacy. I think you just say that PAI's network of partners is 120 local CSOs across 36 countries. My God, including in Bangladesh. I'm from there. So please share a bit about the power of this ecosystem of civil society partners that we mentioned earlier. What are the needs and opportunities, and what can be done to sustain and further develop these networks? Over to you, Nabiha.
Thank you, Shekhar. And yes, your organization, SRMNCAH Bangladesh, has been a very valued partner of PAI for a very long time. And I also should have said at the beginning, congratulations, because you received the Trailblazer Award. One of those who received the Trailblazer Award at ICFP for your catalytic efforts and change maker that you are, not only for Bangladesh and South Asia, but around the world. So congratulations to you.
Thank you so much.
I think Amos said it really beautifully and perfectly about the power of this ecosystem and the fact that, Amos, you said that progress is not achieved alone. And that I think is a clear demonstration of the power of this ecosystem of advocates. The ecosystem, not only the ecosystem that PAI currently has and wants to foster, and we feel it's so important because if we are on this shared mission, we need many. Right? We need many voices, we need many perspectives, we need many sectors, we need new and interesting ways to fund this movement. But we also need to be guided by core values, and certainly our values that we are guided by in our commitment and our engagement with partners who we see as peers, and we see ourselves in that ecosystem approaching it as peers where we're sharing our strengths, we're sharing learnings, we're sharing power, and we also recognize that we are stronger together. I think the other part that is so critical for the ecosystem of advocates is the impact of the collective coming together, looking at what are the priorities on the advocacy side to advance family planning and sexual and reproductive health and rights. Are there cross-cutting priorities that we as a regional community, as a global community, can come together on and coordinate our advocacy, make sure we've got the right evidence that we're bringing forward to government officials who want to do the right things for their people, that we are having shared voice and conversations with the important donors and those who are setting up the agenda at the global level. Because again, we are stronger together. The other piece that I find so inspiring and so urgent about the ecosystem of advocates is the role that advocates and this ecosystem plays in holding decision makers, governments accountable to make sure that services and support is provided, that health systems are functioning, that the financing that has been committed to actually is released and is accessed. And at the same time, and that's the supply side of this equation, right? But if people and communities don't know their rights, if people and communities don't actually access those services and that support, we will not see the impact that we hope to see in our advocacy of universal access to family planning and SRHR. So that has to be part of it. How is civil society looking at both sides of this equation and ensuring that as we talk about access, we're also talking about not just the commodities and the financing, we're also talking about tackling the human element, which is oftentimes the bigger barrier in access. And that is a role for civil society, and an important one. In terms of needs and opportunities, there is an important conversation underway around localization. And I do think it's so important, and certainly PAI, most of our partnerships are with local organizations. But at the same time, localization does not necessarily mean that the other systems, the other histories, the other players in this should not still be connected. So I think the needs are certainly invest in organizations directly as much as you can, not only in their advocacy, but also in their institutions, so they can build strong institutions and sustain their work, but also invest in this ecosystem of partners who are coming together. And we have at PAI great fortune to have worked with various networks and systems around accountability. One being leadership through SMASHA, one of our longstanding partners around Motion Tracker, that is looking at government accountability and are they actually doing the kinds of things they would do to support the commitments around FP 2020 then and now FP 2030. We also recently have engaged with support from the World Bank and Global Financing Facility, what is known as the NGO host. And this is really recognizing that civil society has a very important role to play to come together and engage with governments to set those national priorities and those national investment requests for funding from the GFF to advance those health priorities. And that came about with catalytic funding to try out what is the role of civil society and the voice to hold governments accountable and come together as community. So a lot of very exciting work, and I know we'll talk a little bit more about it, but those are some of the needs and opportunities I see.
Oh, wonderful. Thank you so much. I just take one key point from your speech, which is success and progress is not achieved alone. We all are part of it. We all share this responsibility of achieving the success and win. And thank you so much, Nabia, for leading this, the atmosphere and the civic space for SRH advocacy in all the 36 countries. My God, this is too many. Okay, now I go to Dr. Supriya Madhavan. Supriya is from the Global Financing Facility of the World Bank. And Supriya, Nabia just mentioned that this investment in civil society engagement in support of maternal, newborn, child and adolescent sexual and reproductive health and nutrition, and that the Global Financing Facility has made. A lot of things you are making. I understand that this is the second time in the history of the GFF that the GFF has made such an investment in civil society. Could you talk about what inspired the need for the GFF to make this investment? And what does the GFF hope to see achieved as a result of this investment in CSOs, including youth-led organizations?
Thank you, Shekhar. And again, on behalf of the GFF, congrats to you on your Trailblazer Award. So that's a great question. First of all, we're really happy to be on this stage with PAI, and yeah, it's a really important part of our work and really core to our mandate. And now we realize we cannot achieve our mandate of improving outcomes for women, adolescents, and children without the support of CSOs. And hence, we've made this second catalytic piece of support to PAI. So, I mean, again, going back to what I said, our model, at the core of our model is that it's a country-led, country-owned model and process. And we really stress that should be inclusive and that it should be a multi-stakeholder process of prioritizing and really listening to different voices. So what, as you said, what do we hope to achieve through CSOs? Well, one, it is, as I think Nabia said, it's a matter of bringing voices that are typically not at the table, sitting with policymakers, sitting with ministries of finance, ministries of health, sitting with the donors. But we also feel that those voices of youth-led organizations, of women's groups should be also at the table. So we see inclusivity as a key function of CSOs. The second is accountability, of course, holding the government accountable for what they have committed to do, but holding us all accountable. Again, it's a multi-stakeholder process. We have commitments. We have commitments on a number of things with respect to prioritization, budgeting, service delivery, and just delivering for women and children. And I think CSOs are uniquely placed to in that accountability space. So there's, I think one of the pieces of our model is that we support countries to undertake a prioritization process and thereby develop a prioritized, costed investment case. And we want to see CSOs there in that prioritization process to make sure that the needs of, again, overlooked populations, marginalized populations, youth and adolescents, is included in those priorities. I think Amos gave a really nice example of budget monitoring and advocacy for domestic resource mobilization. So for example, in most of our countries right now, it's pretty opaque to figure out how much of a country's budget is going into adolescent health. We all say we're committed to putting more money into adolescent health, but we really need to track that. And so I think CSOs play a really key role in getting partners, just bilateral and even partners like the World Bank and the GFF to say how much we're putting into adolescent health specifically, to getting government systems, national health accounts, IFMSs, to really, show how much is being set aside for adolescents. So really key piece. Service delivery. So one, we have fragile context, conflict contexts where the warring parties really only trust CSOs to come in and deliver services to the population. So that's key. In DRC, for example, I was just at a roundtable with Dr. Dubé yesterday saying that in DRC, we've actually, the GFF has really pressed on the government to contract with CSOs to provide family planning services in the community to expand choice to adolescent girls especially. And finally, I think there's a huge SPC demand generation role. So one example is Mali. Mali has a large primary healthcare project financed by the World Bank, the Dutch government, and the GFF. And so that's the supply side, strengthening service for women, adolescents, and children. But on the demand side, we've also supported a CSO in Kulikoro to go out and talk to communities about why it's important to allow adolescents to access family planning and SRHR services, why it's important to allow women to go out and access family planning services without their husband's, consent or accompaniment. So, we really see CSO as core to helping us and helping our governments deliver on their commitments.
Thank you so much, Supriya. And of course, I take note that inclusivity is committed and it is being seen to be done. Amos, going back to you. You are one of the lead CSO representatives in the advisory body of the Global Financing Facility. That's wow. Okay, which is known as the Investors Group. I want to ask you two questions. What are some of the needs and opportunities you are emphasizing as you sit in these important donor circles and bring forward the perspective of civil society as one of the members of the community? And the second one is, and I would also like to build on the other question, which is, what do we as civil society advocates need to do better or more of to support the case making that you and others are doing, so we can see increased support, funding and attention for advocacy and civil society? Long questions. If you forget, I can repeat.
Well, that's the second one is a tough one. But anyway, let's see how it goes. So I think you've heard clearly from Doc there that the civil society practically is sitting on the table. The investors group is a group of funders that we have seen that are contributing towards the GFF. Our role practically is we are there to ensure that we highlight what the civil society are doing at country level. Secondly, we also want to make sure that we validate what the implementing countries are doing. The countries that are implementing report to this particular group, and it's important that they have some validation in terms of civil society participation. At the same time, we are there to ensure that countries also are aware, and we encourage them that civil society should be part of the investment case development. And there should be a wider consultative to ensure that the investment cases that are being developed are widely consultative. Secondly, they are people's needs driven. And thirdly, they are country accepted. If that is done, that's what our role is. And then in terms of what we take back, so we do that, and then we take back to our communities what is being agreed. So for instance, we also validate the design of what the countries are doing. We give feedback to the countries and also to the civil society community. And then last but not least, we also try to promote transparency. Now, you asked me what as civil society we should do more to ensure that we seek more funding and support. I think one of the things that has been so difficult, I think, is to ask donors to be accountable. I think at country level, it's been so difficult from the feedback that we are receiving that donors do not share the reports in terms of how their funding is actually distributed. I think it's critical that that should be done. You know, once that is done, I think it helps to ensure to know the actual amount of resource that is going towards health and is not fragmented. Currently, there are discussions of ensuring that there is one plan across. I hope that will be able to be done. And then also in the name of promoting transparency, I think it will be helpful if donors did that, and it will help everyone else know the actual resource that is going out there. And then in terms of seeking more support, I think we need to also ensure that we are very honest with the donors. We know that we are not putting resource on the table, but we need to be very sincere and honest with them that this is the need of the community, this is the need of the civil society, and this is the need of the country. If those discussions are brought and are discussed honestly, I think we'll be able to see to it that there is promotion of transparency. There is the ongoing discussions around power shifting. I think power shifting will only occur if there is a lot of conversation going around and a lot of honest being discussed. And then also the willingness to ensure that that power is transformed and given to the community that deserves. There's always a say that people who want change need to ensure that they push for that change themselves. Thanks.
Thank you so much, Amos. And it is really important to see that if I'm making commitment or I'm accountable for that or not. And of course, transparency in terms of making the commitments and also who are following up. Dr. Samo, I know that FP2030 has the commitment of its own and a mandate to follow up on the commitments. So we know that sustained financing from the discussion, we know sustained financing for family planning is a challenge. But I know like that there is lots of commitments on financing it, and there's a big unmet need also in place. To achieve many of the bold commitments to advance family planning progress, we need to increase resources from diverse sources. What do you see the untapped funding opportunity, and how do we do better leverage what we do have to expand the funding pool and sustain it? It's a lot of things.
Yes, it is a lot of things because we're talking about money, isn't it? So thank you for that question. And you know, we talk about sustained financing. At times we don't know what that means because what's the horizon that you're looking at when you're talking about sustained financing? I want to start answering that question by thanking those individuals who wake up from various donor organizations or even from treasuries of governments to say we will ensure there is financing for family planning. I think there are many way back in 2012, then FCDO, the Bill and Melinda Gates Foundation, you know, USAID making commitments to say we will make this work. So I think we want to thank them for that. The second thing is that, you know, when we're talking about sustained financing, first, we have graduated from the funding to financing these, these endeavors. The most sustainable way to finance a program is through the government. And we have seen that, we say poverty is expensive. Poverty of a country is very expensive because it doesn't ladder up to that progress that we want. So the source of financing that we really need is from the country, because there is this bi-directional equation between investing in family planning and what you get is development. That's what we want. We want inclusive development that is not devoid of rights. Rights-based inclusive development as an outcome for us investing in family planning. For us to get there in that bi-directional equation, we know there are many steps that we are going to get to, right? First, we know that family planning is going to help us in the health indicators. We're working on them in countries through GFF, universal health coverage, to make sure there is financing there. But it should ladder up to development. That is, for me, it's going to be where women have got the power to even finance. It becomes cheaper when a woman can even buy her own products without suffering financial crisis or a disaster. That's where we want to get to. So given where we are, and for us to get there, we will need donors to continue financing in a catalytic way some of those populations who will not be able to buy any products or purchase any services. We will need governments, and thank you, Amos, for the work that you do to ensure that universal health coverage is actually an issue in the countries where we work, and domestic resource mobilization becomes a reality. For those of you who are in ministries of health, take a treasury retreat with your treasury to make sure that they release money. Members of parliament, they release money so that there is financing for family planning programs at a country level. And again, in countries as they transition to upper middle income countries and to developed countries, women will be able to, through insurance, will be able to finance their own products. Lastly, private sector. There is so much money that could come from how we optimize our systems effectively so that private sector financing can also come to the fore through entrepreneurship, economic development programs that actually increase the tax revenue of a country so that women are in a better position. We will get there by 2030, especially with Supraya, World Bank investing catalytically and smartly in the countries where they work. Thank you.
Very smartly articulated, Dr. Samo. I think we have talked about domestic investments and resource mobilization at the country level, and this is really also important. We're not always depending on the donors and always not looking forward to all the external financing, rather than generating local finance is really very important. I'm going to Honorable Dr. Ntara. I have actually a similar question for you, and looking at from the domestic resource perspective, no country actually has an infinite pool of funds to invest in tackling all of the challenges that it faces in their communities. So my first question is, I'm also very, very curious, why is family planning on the Tanzanian development agenda, and how is it resourced? I'll give you a second chance.
Okay. The government, in fact, the government has a budget of about 14 billion to the family planning. But still, there is an increase of 10% from the domestic resources. They are told to finance the family planning program. We also have private sectors. We are also taking them on board to family planning. So I know that this one also is not enough, but we still depend on donors. We depend on donors still to help us finance this family planning. Yeah.
Yeah, like we said before, that no success is achieved alone. No, we need to go a long way, and we need to go all together. And if I could add, what do you think that was most effective in terms of getting the attention policymakers in Tanzania, and actually meaning it's getting the attention of policymakers for them to recognize that access to family planning is an urgent national imperative?
Yeah, thank you so much. And indeed, that's why I'm here. I need GPA That's why I'm here. But again, the parliamentarian, as I said that parliamentarian women, after seeing what was happening in the rural areas, a lot of rape, sodomizing, gender violence. So it was the women who started talking about this family planning. And let me just caution you that we normally see that girls are the one who are affected, girls or women. But today, I want to tell you, even boys are at risk. We talk about girls only and leave aside boys. We talk about girls and leave aside boys. But today, you go to church, boys or girls, they go to church, you find that they are raped. They go to mosque, they are raped. In school, boys and girls are raped. At home, the same problem. So it was from all this made the parliamentarian, especially women, to shout and to say that, oh, no, we need family planning, we need this, the gender violences, we need this rape and whatever is done bad in the society to go away, to go away. I don't know why, but in our country, we think all these are done because people think it's because of the blessing, maybe. If they take a boy and use a boy, they get blessings. And sometimes due to drugs, which are normally spread in the world, I should say. And sometimes it's witch believings. They believe in witchcraft. So that's why our children, and especially girls and boys, are at a very, very risky type of life. So that is what is moved the parliamentarian, as I said, especially women, to say that, no, we need this policy of family planning to be taken aboard.
So great. Sometimes I actually use the term that family planning is a life planning. And you were just mentioning that it's not just contraception, it's not just like methods, it's everything around our society, everything we deal in a daily life. Thank you for joining this. Yes.
Sorry, I said family planning also goes with it goes hand in hand with the healthy of the children.
Absolutely, it does.
That's why I've said that we need to take this seriously. Yeah.
Thank you so much, Honorable Dr. Anthara. Supriya, we actually read, this is a very sensitive question. We read more and more about how civil society is under threat by governments in some of the countries. The NGO host investment from the GFF that PI is stewarding put civil society advocates working in coalition at the center of change and accountability. How is this being received by the GFF country governments? And do you think this is the way forward for how the GFF affects and sustains change?
Thanks for that question. So in terms of how is this being received by governments, I think we have lots of support from very, very forward-thinking governments that see CSOs also as a key part of their strategy to achieve their goals. The government of Senegal, the government of Central African Republic, Cameroon, Uganda, Bangladesh, of course. So we really do need that goodwill from the governments. But look, I mean, we've had civil society and civil society organizations around for decades. And they have been around and participating in the health sector for decades. I think the difference is that today we have a moment where we actually have an architecture within which to work with CSOs. I think, countries have frameworks within CSOs, can operate legally and, without challenge. We have stronger and stronger networks and coalitions of CSOs, which PAI thankfully works with. So why is that good for the GFF? Well, we actually have several entry points that we can tap. And we see that our catalytic funding and efforts can actually go to institutionalizing the role of CSOs in all the different functions that we've talked about this today. So that it's not just that we tick a box when we want to develop an investment case and say, let's make sure CSOs are in the room. No, we want CSOs to be there, you know, as a permanent feature of the landscape of development. So in the monitoring function, in the prioritization function, in the annual budgeting process, ministries of finance should be looking for CSOs to sit with them and ministries of health and the donors in the room to tell them, you know, who are we missing out? Who, you know, where is that equity angle and where are those voices? So to work on this institutionalization agenda, I think we have three levers. So one is we can incentivize governments directly to work with CSOs in more formal and structured ways. So one, we encourage every government to have an inclusive multi-stakeholder country coordination platform of sorts. And in several countries, we're actually seeing subnational platforms at provincial levels, state levels. So we do expect CSOs to be very visible and active in those platforms. And we have discussions every time we go to country, we meet. So this is an ongoing topic of how to strengthen these platforms, and we can incentivize that. We give TA, we can build capacity in governments to make those platforms more effective. The second is we can do this. We can work through organizations like PAI, who can then work with those networks and coalitions in country. We could never do that. We could never reach so many NGOs like PAI can. So, you know, it's just a matter of efficiency. And so we can continue to do that, and we look forward to those kinds of partnerships. And finally, we have a large multi-stakeholder partnership globally. It's a formidable list of partners, of multilaterals, bilaterals, private sector, UN agencies, and we can actively lobby them to invest more in CSOs in countries to achieve our joint goals.
Thank you so much. I would really advocate here on this stage. How about shifting, encouraging to influencing the governments in terms of engaging CSOs? That would really be something great for the advocates to engage more with GFF and platforms like this. Because when you influence the government, it is really something they hear you. And when you encourage the government, it's something, oh, okay. So we want this okay to be yes, okay. Thank you so much. Now I go back to Nabiha. Nabiha, there are actually great needs and remains for family planning and the sexual reproductive health needs of communities. So the two questions, actually, two-part, you can answer all together. What do investments in civil society do for furthering goals of GFF 2030 and our movement as a whole? And number two is how to build on that. What do you hope for as we carry forward together? You say, like, together we achieve more.
So to the first question, civil society makes the goals achievable. Civil society and advocates, we're the truth seekers and the truth speakers, and we're the protectors of progress. And Supriya said it beautifully when she said that civil society is a permanent feature. And that is especially true and lays, is top of mind for me in my home country of Pakistan. We have had, as you all know, a devastating flood. It now will lead to a protracted public health crisis, a protracted economic crisis, and those most affected. And of course, this also is a crisis and has huge implications on any advances on sexual and reproductive health and rights and access to family planning. And who showed up? Who showed up to help? who showed up were local civil society advocates, local civil society members who, yes, are focused on advancing family planning, who are focused on mitigating climate change, who are focused on advancing nutrition. These are the same networks. And so they are a permanent feature, using Supriya's words. And I think we have to think about civil society in that view. Is they may be activated and deployed for a certain issue area, but these are the same people, the same networks, the same perspectives that stand up and step forward on other issue areas, and certainly in times of crisis like we have in Pakistan right now. In terms of hopes, well, I have many hopes, but we probably don't want to go through all of them, but there are a few that really stand out. The first is this piece on how are we supporting the institutions of individual CSOs. And this is not just the piece around capacity development and training. Let's also talk about money, right? Let's talk about money. And just as organizations will invest in issue area advocacy, will invest in conducting research, will invest in policy priorities, are you investing in the infrastructure of the organizations that are implementing that work, that are going to hold the government accountable when there is a great policy win to say a year later, 2 years later, 3 years later, did you deliver on that? We need these institutions to thrive and stay the course. And the second one, which is probably going to be music to your ear, Shekat, is the framing of this conversation, the framing of our call to action around universal access to family planning. I'm a daughter of a scientist, and I had a tough father as a scientist, and he would say, okay, you've got something that you want to do, so what? What impact is that going to have? We have to ask ourselves and ensure that forward, when we're having the discussion around accessing family planning, extending access to sexual and reproductive health and rights, we have to be able to answer the question, so what? What happens when we achieve that win? And the way we define the so what and what happens when we achieve that win, I believe needs to be through the youth lens. Because if this is framed through the priorities and the realities and the concerns of young people and what they are facing forward, if we can get it right for young people, we will get it right for the rest of the community. And we've seen that time and time again across a range of sectors, but I think that is one really critical piece is let's not keep framing it the way family planning and the way SRHR has been framed for the past decades. Let's take a pause and say, is the message sticking? And if it's not sticking, it's time to talk to some new people.
Wow. At some point I got lost, and it's great, when a moderator is lost. Let me come back, because it is, I would really thinking, how about this panel doesn't stop here, and we have like infinite time to continue the discussion. I was really thinking about, how about we have like 1 minute and 15 seconds, each of us, starting with Amos down this line. And this is basically how about voices, because voices is a part of the title of this session. And let us share what voice do you think we should bring into our movement, and why. The why is for 15 seconds. Amos.
Thank you. 15 seconds will not do me justice. But anyway, quick one. Yeah. So Saikat, I think what is important right now is to ensure that we bring in the local private sector. And I would like to even urge Dr. Dube in terms of you getting commitments from local private sector. I think they are very important in terms of the role that they play at country level. Once we are able to governize that and they have a well-coordinated system, we will be able to see that their contribution towards family planning is actually very much highlighted. I think we are missing that gap in terms of how they are contributing the data to our family planning programs. If we bring them to play an important role, I think it will be very important. I mean, we've heard like at global level, the GFF and other platforms, I think the private sector is quite active, but what are we doing at country level to ensure that we bring them together, they are governized, and they are reporting as part of the system that we are supposed to get the data from? I think that will really, really help in that area. Secondly, we need to ensure that the ministries of finance, ministries of community development, ministries of education are part of this sector. I mean, Ministry of Finance, definitely for resource purposes. Ministry of Community Development, they own people, they work with everyone else. Right now, I think a number of countries are looking at cash transfers. That is an opportunity that we have to sensitize people to ensure that as part of family planning, they are able to utilize that space for program development in terms of cash transfers. The Ministry of Education, they own a lot of young people. They are the ones who are educating. How do we bring them in to ensure that the information that they're giving young people is consistent? Once that is done, we'll be able to have a consistent message that will help the Ministry of Health to ensure that service delivery is actually done. Thank you very much.
Thank you very much. I was really looking forward to a Minister of Magic sometimes. Like Minister of Magic, we need to find them. Talk about a magic ministry, like that should do it. Like, oh, exactly. Done. Let's go to Nabiha.
I couldn't agree more. I had ministers of finance on my list as well. We need to be talking to the ministers of finance, and we also have to make the economic case for why these investments matter, both in the short term, but also in the long term. I also think we need to be much better about bringing researchers and those who collect data, track data, to ensure that the kind of research and the kind of evidence that we are putting forward is actually in response to the needs of shaping policy and case making for these kinds of investments. And the third voice is the networks of other sectors, where family planning and SRHR are really central to achieving gains in nutrition, to achieving gains in youth empowerment, in gender equality. To my point earlier on in the conversation, we need many voices, and it needs to be more than us. And I think the extension of saying, who else is going to come to the next conference, the next ICFP? Can we have a huge contingent representing education? Can we have a huge contingent representing nutrition? We need some new and additional people.
Oh, great. And of course, we'll need the Ministry of Magic.
And the Ministry. And please invite the Ministry of Magic.
Yes. Honorable Dr. Antara.
Okay, again, apart from Ministry of Health, Finance and Education, I think we need the Ministry of Social and Community Development, take abroad. But again, if there is organization of people with disability who have been for so long been neglected in this family planning program, you find them saying, I need a child. I need to go to the clinic, but with their disability, they are looked at it like that. One was saying, if I move with my scratches to the hospital, people will look at me and say, is this one also doing that thing? You see? So we need to take this one. We need to take this abroad. And then female who need IVF, I don't know whether they are in an organization or so they also need support, because this IVF is very expensive. Very expensive, so the FP program should consider these people. And it is it's a problem, in fact, psychologically. They are not healthy psychologically. So we need to take these people on board so that all of us will live in a happy life. Otherwise, thank you very much, UNFPA, GPA and EPA and other organizations for making this program possible. I was blind. I was really blind in this, but now I can see.
Wonderful, wonderful, so powerful. I really loved when I was in Zanzibar earlier this year. The beautiful country with beautiful people and, with a lot of commitment makers like you. We really look forward to the beauty of your commitment when we realize them in the next ICFP upcoming. We go to FP 2030, of course, Dr. Dubey.
Of course, we are commitment makers, so we need everybody on board. So if we get all those people on board, I'll be a happy woman, But I want to just add, my first constituency was actually to get people with the purse, like the ministers of finance and private sector on board. So I'm not going to repeat what they said, but that's top of my agenda. I've been visiting countries and I'm seeing that we are leaving some people behind. And these people include refugees and migrants, especially undocumented migrants in countries, because they are being left behind. So we need constituencies, for example, from IOM and then in humanitarian settings to actually come on board and help us with this agenda. As we sit here, COP27 is happening. Those who are having conversations, networks who are having conversations to expand this narrative, we need to understand what they are doing and bring them on board. And lastly, feminists, because the agenda that has been dichotomized between family planning and feminism, etc., I think it's a false dichotomy. And we need actually to make sure they come on board, because this is also about gender equality so that we can achieve economic development that's inclusive for women.
Wonderful. Thank you so much. No commitment should be made without the inclusivity of all the constituencies that you mentioned. Thank you so much. Dr. Supriya, what GFF commits?
Thank you. So, yeah, first on my list is ministries of finance, ministers of finance. I mean, I'm the GFF, so I couldn't go without saying that. But I want to say more specifically, I want them to be in the room with all of you guys. I want them to be in the room with CSOs, with ministries of health, with donors. I think we have no problems talking with ministries of finance. We talk to them all the time, but we end up having separate conversations, and we never have a joined up, aligned conversation. So I think that's really important. That's my added value to that piece. But I will also say we need more women in leadership. We have, in terms of women in government and in the bureaucracy, we need women in leadership. We need female parliamentarians. We need female leaders of CSOs. We need female providers. I mean, here we are saying we're working for women, adolescents, and children, and we keep dealing with men who just can't possibly represent this constituency well enough. I hate to say, but no offense. So I really do think we need women in leadership so that also adolescents can have role models in this. Thank you.
Wonderful. Thank you so much. Can we have a round of applause for all the panelists presented today? And I was really curious about how change is made. And I was thinking, when we're talking about change makers and trackers, I was thinking where change is made. Change is made locally. And when it connects global spaces, it's called local. So change is actually global. And look at this panel. We start from local and global, and this is such a bridge. And thanks to PI for your support, and GFF and AP 2030, all your supports to the government, civil society, and all the actors present in this room and beyond. Absolutely, we don't have any problem talking to the ministers of finance, and of course, we're not actually leaving behind anyone, not even the Minister of Magic, not even the Minister of Hope. Sometime maybe in the near future, people will be calling for a Ministry of Hope. We hope a lot. A lot of hope is actually made on this stage and down there. But how do we track those? People and communities commit, follow the commitments, and they hope that the commitments are realized. And if there is a Ministry of Hope, I hope this realization could also be tracked down someday. I would take just another minute that progress, as we summarize from the points, progress is not made alone. We all together, including you and the people joined behind this room and from live stages and many other places, all together we achieve this change. And I sometimes talk to my colleagues and say, let's work in team. And this team is together, everyone achieves more. So from today's panel, can we ask all the audience and everyone on the stage to rise and say something that you will follow me? I'm not misguiding you in any way. We are stronger. Together. Yes. See you in next ICFP.